Hi, everybody. Today I'm going to be going over developmental psychopathology. And the first part that I want to go over is what exactly is developmental psychopathology. Psychiatrists and therapists, psychologists, and other mental health workers, such as counselors, and anybody who's in substance abuse disorder fields or any mental health field, have to learn how to define a behavior between normal and abnormal. So, how do we do this? You can do this through statistical deviance, which identifies if behaviors fall outside of the norm or if they are within the normal curve. We also have maladaptiveness, which is the question of, do individuals' thoughts or actions pose a threat to the self or to another person, as well as personal distress? Does the issues or thoughts or behavior cause mental stress or anxiety to the individual itself? So professionals utilize the DSM-5 for specific diagnostic criteria to diagnose psychological disorders. And we have certain things that they have to look at in order to diagnose. So this is when we're going to get into some of the topics that I chose to be of interest. So my first topic is that of depression. Major depressive disorder was something that really stuck out to me. The DSM-5 describes it as having one episode of prolonged period of depression, which lasts longer than 2 weeks. It's of being profoundly depressed, sad, feeling hopeless, and the individual must experience 5 of the symptoms listed below that you can see on the PowerPoint, along with one of the first 2 symptoms. And one of the first 2 symptoms would be greatly depressed mood and irritability. The second would be greatly decreased interest or pleasure in life's activities. So they have to at least have one of those. And then they have to have 5 total out of all 7, which includes the first 2. The next 5 would be weight loss, insomnia or sleeping too much, agitation, restlessness, sluggishness, or slowed behavior, fatigue, loss of energy, feelings of guilt, worthlessness, or the inability to not think clearly or be thinking about death or suicide or attempt to commit suicide quite often. So that's where we're going to get into depression and suicide. There are low rates of depression before the puberty years, but rates tend to climb when you hit the adolescent years. Females become twice as depressed as males due to the accumulation of stressful events in their lives and societal expectations. This can be anything from trauma from childhood, such as sexual abuse, rape, to eating disorders or needing to look a certain way that society tells us we need to be. Females practice ruminative coping, which is the unproductive practice of going over problems over and over and over again. Also talking to people about it over and over again, almost obsessing over a problem. Individuals with major depressive disorder have a higher likelihood to commit suicide in their adolescent years. Suicide is also the second leading cause of death among 15 to 24-year-olds. Adults commit suicide more than adolescents do, and more than children as well. Overall, males are more likely to complete or be successful at a suicide attempt. Middle-aged men and women show the highest peak of suicide rates. So usually people in their late 30s to mid 40s, almost to your 50s. Major depression and other affective disorders are most common among adults. So depression is very common among adults. And the average onset age is usually around 20 years old. So we have some warning signs for parents, friends, doctors, psychologists, psychiatrists, therapists, mental health professionals, or anybody else that might need to know these symptoms, such as teachers, caretakers, grandparents, friends, loved ones, anybody who might be around the individual quite often who would want to look for these signs just in case. But if you do suspect any behaviors, please call 911. If you suspect a suicide attempt or thoughts, and contact a mental health professional as well so that you can get the individual the help that they might need. Suicide attempts or possible suicide attempts, usually the individual will be talking about killing themselves or threatening to do so. They will also seek ways to do this, such as weapons, pills, advice on how to do this, or any means of how they may commit suicide and be successful. And if somebody is writing or talking about death and suicide often, that's also a clear indicator that you might want to talk to somebody or get them some help. Seek help for individuals who have any of these behaviors below, such as rage or anger, hopelessness, risky activity without thinking of consequences, feeling trapped, drug or alcohol abuse, withdrawal from friends and family, insomnia, anxiety, depression, dramatic mood swings, lack of purpose, extreme shame, guilt, or feelings of worthlessness. So we're going to move on to topic number 2, which is psychopathology as a development, not as a disease. So it would be a development over the stages of life instead of looking at it as a solely inherited disease. It might just not be that it's something that you inherit when you were born in your genes, but also that something that might be due to environmental circumstances and things that occur in your life. Environment can push your genes to these maladaptive behaviors or these maladaptive disorders that you may acquire. The diathesis stress model states that psychopathology results from an interaction over time as a vulnerability to a disorder or a predisposition and an experience of a stressful event. So an example is in depression, individuals usually have 40 to 60% where they are predisposed or genetically disposed to having depression. But according to what environment they are going to live in is what's going to either bring that out or keep that lying dormant or suppressed. If you are predisposed to depression or any type of illness or psychopathology, the more stressful events you have in your life, particularly in childhood or adolescence, the more likely you are to develop a psychopathology. Some examples of stressors would be like low income, loss of employment, sexual, physical, mental, verbal, or spiritual abuse, neglect, malnourishment, cult involvement, scenes of violence, living in a dangerous environment, a war zone, repression such as sexual repression or spiritual or gender repression, as well as substance abuse use in your home or yourself as well. If you see that any of these things are happening, again, we need to contact the proper authorities, just like as in suicide or in depressive episodes, you want to contact 911 in this case, or any local law enforcement, as well as child protective services, because you can make a huge difference in somebody's life. So our last topic we're going to talk about is that of dementia. Dementia is going to be the progressive deterioration of your neural pathways and functioning is associated with aging and mental decline. Dementia is not a typical part of aging. It's not supposed to be something that we're all supposed to have. So old age, though, is the largest factor in dementia. Rates seem to climb around 75, and dementia can cause depression in older adults and sometimes lead to suicide as well. Dementia does not mean an individual is a lost cause, though. People still are the same person who they are as before, even after they acquire the dementia. Even though they can't verbalize it or maybe remember things all the time, they still are that same person. So it's very important for family members and, children and caretakers to remember this. So some types of dementia are vascular dementia, which is caused by strokes, and your memory and functioning degree is going to be dependent on what the severity of the stroke was and the location within your brain. We also have Alzheimer's and Parkinson's, Huntington's disease, alcohol-related dementia, which is caused by excessive use of alcohol over long periods of time. We have frontotemporal dementia, AIDS dementia, and Lewy body dementia. And just to go over these real quick, Lewy body dementia is as common as vascular dementia. It's caused by protein deposits called Lewy bodies that are deposited in neurons. And motor problems occur such as visual hallucinations, attention, alertness problems, and unpredictable behaviors. Frontotemporal dementia is early onset dementia. It's associated with the shrinking of the frontal and temporal lobes that are within the brain. Executive functioning problems such as impulsive behavior, poor judgment, and memory problems are known to be common with this. Parkinson's disease is also a Lewy body disease where in the subcortical areas of the brain, it contributes to major motor problems such as trembling, shaking. You see people with shaky hands quite a bit, freezing while you're walking. And in later years, it develops into a form of dementia. And we already spoke about Alzheimer's and vascular dementia. Huntington's disease is caused by a single dominant gene. The subcortical brain damage results in involuntary flicking movement of the arms and legs, hallucinations, paranoia, depression, and personality changes. We talked about alcohol-related dementia, and AIDS dementia is caused by the HIV virus. It causes encephalitis, behavioral changes, decline in cognitive function, memory, and slowing of motor functions. And back to the alcohol-related one, there is a specific one that is called Wernicke-Korsakoff syndrome, and that is the primary disease within alcohol-related dementia with memory problems. So we have to remember if someone that you know or love has dementia, once again, do not write them off as they don't understand. Make sure that nursing home facilities and caretakers are providing proper treatment. Contact proper authorities if you suspect elder abuse. And make sure that they receive proper treatment from doctors and care professionals as well. That they, get a second diagnosis if it's needed, or possibly a change of location if they are not happy in the location that they're in. They still have feelings and they still, can understand things even if we think that they may not be able to. Remember that they still are your loved ones. And at the end of the PowerPoint, I did include a poem that's called Cranky Old Man, and it kind of shows the idea that they still have awareness even if they do have dementia. So thank you, and I hope you enjoyed.